Guided visualization script, upper extremity muscle anatomy, introduction and preparation. Welcome to this comprehensive anatomical journey through the upper extremity muscles. Find a comfortable position, close your eyes, and prepare to visualize the intricate muscular architecture of the arm, forearm, and hand. We'll explore each muscle's origin, insertion, nerve supply, and clinical significance as we build a complete three-dimensional understanding. Take 3 deep breaths and imagine yourself as a skilled anatomist, capable of seeing through skin and fascia to observe the beautiful complexity of human musculature. Part 1, shoulder girdle and proximal arm, the trapezius, the great stabilizer. Begin by visualizing the broad, diamond-shaped trapezius muscle spanning across the upper back and neck. See its 3 distinct portions. Upper fibers, origin, picture the external occipital protuberance and the nuchal ligament at the base of the skull insertion. Follow the fibers as they attach to the lateral third of the clavicle nerve supply. Visualize the spinal accessory nerve, CNX, and C3-C4 nerve roots innervating these fibers. Clinical note, observe how damage here causes shoulder droop and inability to shrug middle fibers. Origin, see the spinous processes of C7-T3 vertebrae insertion. Watch as these horizontal fibers insert into the acromion and spine of the scapula. Action, visualize the scapula retracting toward the spine, lower fibers. Origin, from the spinous processes of T4-T12 insertion into the medial spine of the scapula. Clinical significance. Note how weakness here contributes to scapular winging and poor posture. The deltoid, the shoulder's powerhouse. Now focus on the deltoid, wrapping around the shoulder like a muscular cap. Anterior deltoid, origin, lateral third of the clavicle, sharing space with the upper trapezius insertion. Insertion, deltoid tuberosity of the humerus nerve. Axillary nerve, C5-C6. Clinical pearl. Visualize how anterior deltoid tears affect forward arm elevation middle deltoid. Origin, acromion process insertion, deltoid tuberosity. Function, see it as the primary shoulder abductor beyond 15 degrees. Clinical note, this portion is most commonly injured in deltoid strains. Posterior deltoid, origin, spine of the scapula, insertion, deltoid tuberosity, roll, visualize its contribution to shoulder extension and external rotation, the rotator cuff, the stability quartet. Picture the 4 rotator cuff muscles working in harmony to stabilize the glenohumeral joint, supraspinatus, origin, supraspinatus fossa of the scapula, insertion, greater tubercle of the humerus, superior facet, nerve, suprascapular nerve, C5, C6, clinical significance, most commonly torn rotator cuff muscle, visualize the empty can test position, infraspinatus, origin, infraspinatus fossa, insertion, greater tubercle, middle facet, nerve, suprascapular nerve, function, primary external rotator, see how it works during throwing motions, teres minor, origin, lateral border of the scapula. Insertion, greater tubercle, inferior facet, nerve, axillary nerve, clinical note, often spared in rotator cuff tears due to its separate nerve supply, subscapularis, origin, subscapular fossa, anterior scapula, insertion, lesser tubercle of the humerus nerve, upper and lower subscapular nerves, C5, C7, clinical importance. Visualize the lift-off test for subscapularis integrity part 2. Arm muscles, anterior compartment, the flexors biceps brachii. Picture this iconic 2-headed muscle, long head origin, supraglenoid tubercle of the scapula, short head origin, coracoid process, insertion, radial tuberosity, and bicipital aponeurosis, nerve, musculocutaneous nerve, C5, C7, Clinical pearl, visualize how biceps tendon ruptures create the Popeye sign brachialis. Origin, distal half of anterior humerus. Insertion, coronoid process of the ulnar nerve, musculocutaneous nerve, lateral part, and radial nerve, medial part. Clinical note, the workhorse of elbow flexion, working in all forearm positions, coracobrachialis. Origin, coracoid process. Insertion, medial midshaft of humerus, nerve, musculocutaneous nerve. Clinical significance, used as a landmark for identifying the musculocutaneous nerve posterior compartment, the extensors triceps brachii. Visualize this three-headed extensor, long head, infraglinoid tubercle of the scapula, lateral head, posterior humerus, above spiral groove, medial head, posterior humerus, below spiral groove. Insertion, olecranon process of the ulnar nerve, radial nerve, C6, C8. Clinical note, long head injuries affect both shoulder and elbow function. Part 3, forearm muscles, anterior compartment, the flexor pronator group, superficial layer, pronator teres, origin, medial epicondyle of humerus and coronoid process of ulna. Insertion, lateral radius, midshaft, nerve, median nerve. Clinical pearl, compression site for median nerve in pronator syndrome flexor. Carpi radialis. Origin, medial epicondyle. Insertion, base of second and third metacarpals. Nerve, median nerve function, wrist flexion and radial deviation. Palmaris longus. Origin, medial epicondyle insertion. Palmar, aponeurosis. Nerve, median nerve, clinical note. Absent in approximately 14% of people, used for tendon grafts, flexor carpi ulnaris. Origin, medial epicondyle and olecranon. Insertion, pisiform hook of Hamate, fifth metacarpal nerve, ulnar nerve function, wrist flexion and ulnar deviation, intermediate layer, flexor digitorum, superficialis, origin, medial epicondyle, coronoid process and radius insertion, middle phalanges of digits 2-5. Nerve, median nerve, clinical test, visualize isolating FDS function by holding other fingers extended, deep layer, flexor digitorum, profundus, origin, proximal ulna, and interosseous membrane. Insertion, distal phalanges of digits 2-5, nerve, median nerve, index and middle fingers, ulnar nerve, ring and little fingers. Clinical significance, only muscle that can flex the DIP joints, flexor pollicis longus, origin, radius and interosseous membrane. Insertion, distal phalanx of thumb. Nerve, median nerve, anterior interosseous branch. Clinical note, essential for pinch grip strength, pronator, quadratus. Origin, distal ulna, insertion, distal radius, nerve, median nerve, anterior interosseous branch, function, primary pronator of the forearm posterior compartment, the extensor supinator group, superficial layer, brachioradialis, origin, lateral supracondylar ridge of humerus, insertion, styloid process of radius, nerve, radial nerve, function, elbow flexion when forearm is in neutral position, extensor, carpi radialis, longus, origin, lateral supracondylar ridge, insertion, base of second metacarpal nerve, radial nerve. Clinical pearl, preserved in high radial nerve lesions, extensor carpi radialis, brevis, origin, lateral epicondyle insertion, base of third metacarpal nerve, posterior interosseous nerve. Clinical note, common site of tennis, elbow pain. Extensor, digitorum. Origin, lateral epicondyle. Insertion, extensor expansions of digits 2-5. Nerve, posterior interosseous nerve. Function, extension of fingers and wrist. Extensor digiti minimi. Origin, lateral epicondyle. Insertion, extensor expansion of fifth digit nerve, posterior interosseous nerve. Clinical use, contributes to independent little finger extension, extensor carpi ulnaris. Origin, lateral epicondyle and ulna. Insertion, base of fifth metacarpal. Nerve, posterior interosseous nerve. Function, wrist extension and ulnar deviation. Deep layer, supinator, origin, lateral epicondyle and proximal ulna. Insertion, proximal radius. Nerve, posterior interosseous nerve. Clinical significance: compression site for posterior interosseous nerve extensor pollicis longus. Origin: ulna and interosseous membrane. Insertion: distal phalanx of thumb nerve, posterior interosseous nerve. Clinical pearl: forms the ulnar border of the anatomical snuff box, extensor pollicis brevis, origin, radius, and interosseous membrane, insertion, proximal phalanx of thumb nerve, posterior interosseous nerve, function, thumb extension and radial abduction, abductor pollicis, longus, origin, radius, ulna, and interosseous membrane, insertion, base of first metacarpal, nerve, posterior interosseous nerve. Clinical note: involved in de Quervain's tenosynovitis, extensor, indicis, origin, ulna, and interosseous membrane, insertion, extensor expansion of index finger. Nerve: posterior interosseous nerve function, independent index finger extension. Part 4. Intrinsic hand muscles. Venar muscles: the thumb's servants, abductor, pollicis brevis, origin, flexor, retinaculum and trapezium, insertion, proximal phalanx of thumb, radial side, nerve, median nerve, recurrent branch. Clinical test: pen test for median nerve function, flexor pollicis brevis, origin, flexor retinaculum and trapezium, insertion, proximal phalanx of thumb nerve, median nerve, superficial head, ulnar nerve, deep head. Function: thumb flexion at MCP joint opponens pollicis, origin, flexor retinaculum and trapezium, insertion, first metacarpal nerve, median nerve, recurrent branch. Clinical significance: essential for opposition and precision grip. Hypothenar muscles: the little finger support abductor, digiti minimi. Origin, pisiform and flexor retinaculum. Insertion, proximal phalanx of fifth digit nerve, ulnar nerve, deep branch. Function: little finger abduction, flexor digiti minimi. Origin, flexor retinaculum and hamate. Insertion, proximal phalanx of fifth digit nerve, ulnar nerve, deep branch. Action, little finger flexion, opponens, digiti minimi. Origin, flexor retinaculum and hamate. Insertion, fifth metacarpal nerve, ulnar nerve, deep branch. Function: little finger opposition. Deep hand muscles adductor, pollicis, oblique head, second and third metacarpals. Transverse head, third metacarpal. Insertion, proximal phalanx of thumb, ulnar side, nerve, ulnar nerve, deep branch. Clinical test: Froment's sign for ulnar nerve integrity. Lumbricals: 4 muscles. Origin: tendons of flexor digitorum profundus. Insertion: extensor expansions of digits 2, 5. Nerve: median nerve, first and second, ulnar nerve, third and fourth. Function: MCP flexion with IP extension, interosse, palmar interosse, 3 muscles. Origin: metacarpals 2, 4, and 5, insertion, proximal phalanges and extensor expansions. Nerve, ulnar nerve, deep branch. Function: adduction toward middle finger, PAD, dorsal interosse, 4 muscles. Origin: adjacent metacarpals. Insertion: proximal phalanges and extensor expansions. Nerve, ulnar nerve, deep branch. Function: abduction away from middle finger, DAB. Clinical integration and visualization. Now, visualize common clinical scenarios. Median nerve injury. Picture the benediction sign with loss of thumb opposition and index middle finger flexion weakness. See how carpal tunnel syndrome affects the thenar muscles, creating the characteristic ape hand appearance. Ulnar nerve injury. Visualize the claw hand deformity with hyperextension at MCP joints of the 4th and 5th fingers. See the loss of interosseous muscle bulk and the positive Froment's sign. Radial nerve injury picture, wrist drop with inability to extend the wrist or fingers. Visualize how high radial nerve lesions affect triceps function, while low lesions spare brachioradialis. Rotator cuff pathology. See the painful arc of motion, the positive impingement signs, and the compensatory scapular movement patterns that develop with rotator cuff tears. Conclusion: Take a moment to appreciate the incredible complexity and integration of the upper extremity muscular system. Each muscle works in concert with others, creating the precise movements that allow us to perform everything from delicate surgery to powerful throwing motions. Notice how nerve injuries create predictable patterns of weakness and deformity, and how understanding the anatomical relationships helps in clinical diagnosis and treatment planning. As you slowly return your attention to the present moment, carry with you this comprehensive understanding of upper extremity anatomy, ready to apply this knowledge in your clinical practice or studies. Take 3 deep breaths, wiggle your fingers to appreciate their complex muscular control, and open your eyes when you're ready. This guided visualization script provides a comprehensive overview of upper extremity muscle anatomy, including origins, insertions, innervations, and clinical correlations. Use this as a study tool or teaching aid to develop 3-dimensional anatomical understanding.